Welcome to Empowered UTI Care, how to heal, protect, and prevent naturally. So this class is really where I'm going to help you feel more confident and less overwhelmed when it comes to UTIs. This is not about doing everything. It's really about understanding what actually helps and at what phase of the process that you're in. So if you've had more than one UTI, you're not alone. Recurrent UTIs are common and they're not your new normal. They don't have to be your new normal. Your body was designed for healing, so you're not just going to survive flare after flare. This class is really going to give you the tools and understanding that most women are never taught about recurrent UTIs. In this class, I'm going to walk you through how to respond at the first sign of a UTI, how to use antibiotics in a way that supports your body, and really how to rebuild the bladder and the microbiome afterward, and simple daily habits that prevent the repeat infections. So we're just going to take it one step at a time. UTIs don't always start suddenly. Often the first signs and symptoms are that burning, pressure, or fatigue, and sometimes your urine may look a little cloudy and smell stronger. Sometimes it can just feel off and you can't really explain. So catching these early symptoms will really give you more options about how to stop that infection in its tracks. The first 6 to 12 hours after symptoms start are some of the most important. And this is when hydration and rest and really reducing the irritation can shift that outcome. So simple steps like electrolytes. Adding electrolytes to your water, avoiding triggers like sugar and caffeine, and really just slowing down. Your body's starting to be warned that there is an infection brewing, so slow down. This can really make a big difference in the beginning. There are gentle at-home supports that can help calm the bladder, and one of my favorites that I use a lot in clinical practice is called UT Vibrance, Crisis Intervention. It's the one you want on board first right out of the gate. So you're adding in your electrolytes, you're staying hydrated, but the UT Vibrance Crisis Intervention is really more about a cell adhesion or an anti-adhesion support. And this is what you want during those first critical hours. Also, herbs like marshmallow root or corn silk can really support the bladder lining as well. And then urinating fully and regularly really helps flush out those irritants. You want to get those little scrappy guys out of there as soon as possible. But if symptoms continue for more than 24 hours, then that can signal to you that it's time to reassess and see if you need more advanced care. Urine pH plays a bigger role than most people realize. In fact, it's one of the things that I've noticed that is rarely talked about. So when urine stays too alkaline, bacteria have an easier time sticking to that bladder wall. And so tracking your pH can really help you understand what environment your bladder is in. And the goal is not perfection, but awareness. You want to know what your pH is, and there is an optimal range that is going to help you resolve those symptoms sooner and possibly prevent you from having to use an antibiotic. Early action matters, right? The sooner you respond, the more control you have over that outcome. You're not powerless here, even if it's felt that way before. Sometimes antibiotics are necessary, and that's okay. It doesn't mean you failed. The key is to not stop at killing bacteria. Your body still needs support during and after treatment. So if you're going to end up on an antibiotic, I want you to think about using antibiotics intentionally. Using antibiotics intentionally means knowing the dose and the duration and taking them as prescribed. A lot of the times I see in my clinical practice that antibiotics are prescribed, and as soon as women start to feel better, they stop the antibiotic. And what that does is it leaves behind what we call educated survivors in this bacteria. So if possible, it helps to know what antibiotic you're being prescribed, how long the duration is, and also if the antibiotic was chosen based on a culture or based on routine best guess by your provider. Information really matters. Antibiotics don't only affect the bladder. I think most of us know that, but they also affect the gut and the vaginal microbiome. Taking antibiotics, and you want to take a probiotic away from the antibiotic at least by 2 hours, but it's important to make sure that you're adding that counterbalance in there. So taking your probiotics away from your antibiotics by at least 2 hours, and then continue to take them after you finish your antibiotic to restore balance in the gut microbiome. And this step is the one that's often skipped, but it really matters a lot to ongoing support and health. So let's chat about what a biofilm is. Some bacteria really protect themselves by forming biofilms. And these are biofilms are just little shields. Think of them like little bacterial shields. And bacteria use them to make themselves invisible to the antibiotic. And it makes the bacteria much harder to clear. And this is one reason why infections keep returning because the biofilm is not addressed. There are supplements that help disrupt biofilm over time. And these don't replace treatment, but they really support the process and can help make sure that you interrupt that pattern of recurrent UTIs. So it's about strategy, right? Not force. Clearing bacteria is not the same as healing. So your bladder and microbiome need nourishment and rest. So simple foods, hydration, avoid irritants, support your recovery. Even when symptoms improve, healing is still happening. That's why I mentioned earlier, don't stop your antibiotic once your symptoms are improving. The healing is still taking place. And after that, the bladder and microbiome, they often need 1 to 2 weeks to fully recover, sometimes longer if you're in a recurrent UTI pattern. Symptoms gone does not always mean healing is complete. So this is where after treatment is so important. So post-treatment practices I always like to focus on are continue your probiotics, continue with hydration, and really rest. Prioritize your sleep. Prioritize taking it easy to help protect the progress. This is where prevention really does begin and help you avoid those recurrent UTIs. Here's some prevention basics for you. Basic habits still matter. So, urinating before and after sex, gentle hygiene, making sure you're not using products that are causing an imbalance in your pH. So, pH balanced products support the urinary tract. And for some women, it's important to assess if you need vaginal estrogen. This can be really important, especially postmenopausal. This is a great conversation to have with your primary care provider or your women's health provider. If you notice that you're having recurrent UTIs and you're postmenopausal and even late perimenopausal, adding in that vaginal estrogen can be a game changer. Urine pH continues to matter even outside an active infection. So I mentioned early on that monitoring and managing your first morning urine pH, and you do want to check that first morning urine pH. You can purchase a urine pH test strips, very inexpensive, and you want to check that first morning urine pH. We know it's going to fluctuate throughout the day, but that first morning urine pH can give you good indication of the status of your bladder and if you have a habitable environment for bacteria to grow. So just monitoring it periodically helps you notice patterns before symptoms return. And many times in clinical practice, I've seen where women can actually stop a UTI in progress by managing that pH. We really want to target a 5.75 to 6.0 first morning urine pH, and that seems to be the best zone to make sure that your bladder is not a nice, cozy environment for bacteria to replicate. And each pathogen or bacteria does have a preference from what we find in the literature for pH to be able to replicate. So this is an important one. This is why urine pH really matters. Tracking doesn't have to be complicated. So simple notes about hydration and symptoms and pH can reveal patterns over time. So I would encourage you to create a notes app and just pay attention to that. Like, are you hydrated, dehydrated? What are your symptoms? What are you feeling? What is your first morning urine pH periodically? And just start to pay attention to that. So awareness really creates that clarity in your specific pattern. These are optional supports that some women find helpful. They're tools, not requirements, but your body's response is really the best guide. And these are things that I use day to day in clinical practice to help women. This process, again, isn't about perfection, it's about consistent support. So you have to establish those small daily habits to create the long term wins. Checking in weekly or monthly really helps you stay ahead of those symptoms. This is proactive care, not reactive, right? We want to be preventive. And if you've had 2 or more UTIs in 6 months, that's a sign that you need to dig deeper. At that point, we're really looking beyond the bladder. We're looking at gut health, hormones, the nervous system, and even sometimes genetics play a role in there. So, again, more than 2 UTIs in 6 months, it's time to dig deeper. If you're ready to go deeper, there are next steps available. You have a one on one strategy session with me, supplement guidance, deeper education, and this can all help you move forward with clarity. The goal here is not to control your body, it's to understand it. Clarity leads to calmer decisions, and calmer decisions lead to better outcomes.